Good afternoon, everybody. Thank you so much for being here with me this afternoon. We are delighted to introduce you to our host today who came to present to us online. This is Megan, and she is with Karya. She's the manager of network partnerships, and she's going to talk with us today about the power of social prescribing. So we're very excited to have her join us online today. So if everybody in the virtual room will join me in a nice big clap and warm welcome for Megan. Megan, thank you so much for being here today.
Thank you so much for having me. There's someone who has a raised hand.
Yes. So I'm just going to take this moment just to ask that anybody who would like to talk, can you please type your questions or statements in the chat box and I will read them out aloud. I've had more than once where a panelist when a guest raises their hand and then I say, "Oh, let's get them to talk," and I unmute and they say, "Oh, no, 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 that was an accident." So yeah, I would really just preferred if you have a question, to please type it in the chat box, and I will go ahead and forward your question to Megan. You can do that at any time throughout the presentation. So anytime you don't feel like you have to wait to the end to ask a question or make a statement, I'll be monitoring the chat box. So now I'm going to give it away to Megan. And Megan, would you like to introduce yourself a little bit better than I did?
Sure, absolutely. Thanks, Sarah. Hi, everyone. I cannot see who's in the room or any of that stuff, but I just wanted to say thank you so much for to Sarah for inviting me, and I'm really excited to be here. So as Sarah said, my name's Megan. Sorry, excuse me, and I am the manager of network partnerships. So that my role at Caria, I manage. The Way In network. So I manage the four agencies that are a part of that group. And then I manage the In Place Social Prescribing Network, which is what I'm here to talk about today. And there we'll get into who and who are the partners in that group. But as we begin, and I'm just going to read because I'm not, and my apologies for any pronunciations that I mispronounce. But as I begin, I want to acknowledge that we are currently on the traditional unceded territory, the Blackfoot name Mokinsis, where the Bow and Elbow rivers flow as one. I want to recognize the authentic history and oral traditions of the people of Treaty 7, the Siksika, the Piikani, the Kainai, the Tsuut'ina, and the Ayarhe Nakota nations, and the Northwest Métis and Otemposoak, Districts 5 and 6, in the spirit of respect, reciprocity, and reconciliation. Together we work to strengthen individuals, families, and communities to live together as our rivers do, in confluence, and we honor all peoples who care for and share this sacred space.
Great job, Megan.
Thank you. All right, so these are the three learning objectives or outcomes of this webinar for you guys to kind of take away. So understanding the concept or model of social prescribing, be able to identify the benefits for older adults who may be like yourselves or your colleagues or peers, an increased awareness of how social prescribing is being implemented in Alberta, and then to understand specifically in Calgary, the In Place network and how we're supporting older adults. All right, so why we're here. So what is social prescribing? So the Canadian Institute for Social Prescribing defines it as a model that enables the healthcare providers and social service professionals to connect individuals with those non-clinical supports and community resources that address an individual uh, and community needs based on their social determinants of health. So it's driven by this idea to bridge the healthcare system with what's going on in community, because we know that your health is not just what's happening in the healthcare system. A lot of it has to do with how you're interacting with the community, what is going on in your life, and the pieces around social determinants of health and how that is impacting your well-being as well. Okay, so the benefits of social prescribing. So they address the social determinants of health, and we'll kind of get into what those are. Uh, it aims to reduce the utilization of the healthcare system for a non-medical related issue. So some of our referrals come from the emergency room where someone's going to use the healthcare system for that social connection. So they know that someone's going to be there 24/7. Someone will answer their questions, be there to talk to them, and have that kind of engagement with community. But that's not really what the emergency room is there for. So by having that referral come back into community, we're able to address those social isolation needs that older adult may be experiencing. It's person-centered and it's holistic. So that means that it is driven, whatever the care plan or service plan is driven by that individual, by the older adult. So they determine your healthcare provider may think you need X, Y, and Z, and they'll refer you to us, but you determine what X, Y, and Z is and how you want to move forward. And then holistic means that we're looking at the whole picture. So not just your medical, like what's going on with you medically or physically, but what about your mental health? What about how are you connecting in community? Um, are you getting the food that you need? Uh, is your housing safe? Those types of things our team would talk to an older adult about. And then ultimately, the goal would be to improve your experience when you're actually accessing that healthcare system, where you're not experiencing long wait times because people are utilizing it for the reason that it is there for. Okay, and then the benefit specifically to the older adult group that this program and social prescribing is intended for. So the ideas or benefits around it are that it enhances your social connection. So it addresses those areas of isolation and loneliness and kind of brings meaning back into how you're connecting with your community. And community can be however you define it. So it doesn't have to be like your neighborhood, it could be your city, it could be your friends, it could be your church group, it could be whatever you define community and how you want to reconnect if you have. If you are experiencing that isolation or loneliness. It can prevent cognitive decline or kind of stabilize it. So what we're finding is a lot of the older adults who are a part of our program, they're experiencing a stabilization, which is ideal for this age group. It improves your mental health. So the more that you're engaged with people and connected and experiencing life with other people, the better your well-being, and whether that's your physical health, your mental health, your cognitive health, all of those things are impacted. And then the other piece that's really interesting, and that the Canadian Institute of Social Prescribing identified, is that it encourages intergenerational learning. So a lot of the groups that we connect our clients and our participants with, they're going to a group that has multiple ages, just lots of different experience within that room. And so with that, you get the wisdom, and you get to share your wisdom, and you get to hear the experience of that younger generation as well. Please, if you have questions, put them in the chat as well.
And I was going to say, I don't have a question, but I definitely, I have a statement and I wanted to agree. I love intergenerational programming. My background is therapeutic recreation and disability studies, and it is my favorite program to plan when we have intergenerational activities. I just think there's so much like you said, wisdom to be shared between different generations. So I
Yeah.
love that.
Yeah. Okay, so determinants of health or social determinants of health, that's a big term. But what we mean and what our team kind of looks at, and I've spoken a little bit about it before, is how you're engaging socially in the community. So are you participating or do you want to participate in activities? And you can determine whatever those activities might be, and the team would try and figure that out. Do you want to explore what does it look like to volunteer, or what does it look like to do an outdoor activity within this group? Um, and so our team kind of explores what are the opportunities in the city, and then would connect you to the pieces that you've identified. We look at your social support. Do you have that natural support network to help you uh, when you are struggling or having a hard time? And how can we, if you don't have that, how can we help kind of build that in your community so that if you do end up needing support, that there are people there to help you? We look at your safety and security. So this is more around um, your finances. Do you have all the benefits that you're eligible for? Uh, if you're under 65, do you have a job that's like fulfilling or that's meeting your needs so that you can afford life? And then are you safe? And then that kind of translates into your physical environment. So do you have safe housing? Do you have safe transportation? Do you have an ability to get around in the city so that you can connect? Because Calgary is it is a car vehicle built city. So do you have the ability to get around? And what does that look like if you don't? And our team can kind of give the individual what those programs are, and then can walk alongside them to help coach on how to use those programs. We also look at your physical and mental health. Do you want to engage in like fitness, whatever that means for you? Do you want to look at your mental health? Do you want to be connected to things that can kind of help around that piece? And then your personal well-being. Do you have the supports in place for um, resiliency and your emotional well-being as well as your physical? So it as well as like food and nutrition, and do you have access to those pieces to kind of help address those areas? All right, so what is happening in Alberta? So in 2022, social prescribing and the initiative was started by an investment by the government of Alberta into the three cities there, as you see on the screen. And then it's expanded into a wider range of programs across the province. So if there are professionals on this call who have people that live in those areas and are curious and want connection to those programs, please let me know and I can facilitate that connection piece. Healthy Age in Alberta is kind of the coordinator of all of this work. So they are similar to my role where I coordinate the four agencies in the city. They coordinate all of these programs and make sure that we're all in alignment and following. We're all kind of gathering the same data and telling so that we can all tell kind of the same story of how whether our programs are the same, they're all kind of different and implemented differently, but we're all telling the same story of the impact that we're having um, in supporting older adults. And I think after this, I have a short video that you guys can watch.
There's no sound, Megan.
I don't
Oh,
think
there we
I'm
go.
progressed so fast, and I would have been able to do all the things that I'm doing. But because of the program, I got an uplift.
Because you're stuck home and you're so used to it that you don't go out, but you don't know what you're missing when you don't go out.
Social prescribing is a formal referral pathway. So a healthcare provider, like a doctor or nurse, pharmacist, they would recognize that maybe their client has some unmet social needs, and they would make a referral, a social prescription, to a community-based organization. And then that community-based organization where there's a link worker would then connect that person to all of the programs and services that exist within the community that meet their needs.
So I provide primary care to older adults, actually 60 up. Some have good natural supports, good networks. Others don't. There's various degrees of loneliness and isolation.
The important element of what we do is walking alongside them as they navigate through those resources and accessing them. Just having that connection to somebody that's willing to walk alongside them is really key to them being successful.
Christine introduced me to Karia Village Commons, and I have really been grateful that I had the space to improve my health.
Even for the initial intake, it can be 15 minutes, it can be an hour.
I usually be in the house, but now I am able to participate in learning programs, meeting people. This program will be really of great help to anybody who has been just doing alone or sitting around their house. Now you have time to go outside and do some exercises or do some sports activities to fulfill your or enhance your personality.
We set up an intake visit where we do an assessment that basically asks a whole bunch of questions to get a better idea of their situation. So in terms of finances, social supports, food security, housing, it really encompasses all aspects of their well-being. And then together we develop a service plan where we list goals that we're going to work on together and in a time frame that we want to complete them by. And this is very much a collaborative approach. So it's not me just saying you need to do these things to improve your well-being. We discuss the supports they're looking for, and through the intake, I'm also able to see, are there any gaps and resources that I can suggest that I really think they could benefit from as well.
You could do crafts one day, you could do, it was endless. Now you could have carpet rolling, birthdays once a month. Just, I can't even remember how much, but there was something for everyone. I feel like I would have had a hard time when it came to just about everything, getting the house for full, getting the taxes done, getting all these little key things done. And they knew what was coming up, and they knew what to do, and they knew where to go.
I can see like that confidence that they've built, and now they're able to take initiative when problems come up. They're more aware of the resources available to them. So yeah, just seeing that has been really, really amazing.
Awesome. Perfect. Okay, so now we're just gonna go kind of more locally. So we kind of talked about what's happening in the province, and now we're gonna talk about what's happening here in Calgary. So the Social Prescribing Network is a unique partnership with Calgary-based agencies. So those include CARIA, Jewish Family Service or JFSC, and then Calgary Seniors. So these are the three main partners, and our team connects with older adults in their own home or in a convenient location. So we're very flexible on where we will meet someone, where the team will meet, and it really is determined on where that older adult or whoever's been referred to us is most comfortable. And this network has been around since 2020 with the purpose of creating that formal referral pathway. So creating those relationships within the health system so that they understand how to refer to us and how we can help navigate the system for an older adult.
Can I ask, Megan? I
Mhm.
because so I have been in therapeutic recreation for quite some time, and I always remember pre-COVID saying how important it is that like quality of life is addressed and that social connection. But it was always, and I mean, if there's any professionals on this line, you might know that rec is always the kind of the first one to go when there's budget cuts. But now it seems like post-COVID people are kind of recognizing how important that is. So I just
Mhm.
wondered, this was 2020, so this came out of COVID, that it was kind of recognized that like, whoa, we need something for this.
So this came out of this partnership and approach came out of the weigh-in network. So our experience in the weigh-in network side, the 20 years that that network has been going on, and kind of understanding and the knowledge that we have from that group is when we were supporting older adults in that network, they would be lost when they went to the healthcare system. And so that's kind of what precipitated, wrong word, but whatever, this network. And so um, with the purpose of creating those meaningful referral pathways and connection with healthcare systems so that when our client goes into the system or an older adult is coming back out into living independently in the community, they have that connection piece with community support. So that's where we came from.
I love that. Okay. I think it's super important.
And you're right, it started during COVID. So trying to build relationships with healthcare system during that time was a bit tricky. And so it started, majority of our referrals and relationships started with the primary care network rather than acute care because they were like, we don't have the capacity
Yeah.
to engage in this way. And so it slowly built to now acute care is also referring.
Hmm. Thank you.
Absolutely. And so our funding for the In Place Social Prescribing Network comes from the government of Alberta. It's funded until right now until 2027. And it comes from a continuing care grant. So it's looking at those in non-medical in-home support so that you can, uh, with the goal that you can live as long as possible where you want, as long as possible, safely. Okay, so eligibility criteria for this network of support. So it's for those who are 55 years of age and older, limited natural supports or natural supports who maybe don't know the system or are struggling to support you or
Language barriers, maybe?
language could be a piece. They require community-based services, so it is a goal-based program. So you have to have some type of goal to be working towards that our team can help support you with. And then interaction with the healthcare system. So we're really, these are eligibility, but it's the only kind of key pieces are you have to be 55 years of age and older and living within the city of Calgary. And then the other pieces are kind of guidelines, but not a hard and fast rule. You, with the caveat that you do need to be providing consent for the program. So you were asked kind of multiple times if you consent to be receiving support. And then all the services, all the navigation kind of and connection and warm transfers and that those pieces are all free because of the grant that we are receiving. But sometimes the services that we are connecting you to would have a cost associated with them. So these are some examples of who you might come across, who you could potentially encourage to get a referral. So it's someone who's maybe going in and out of their doctor's office or frequenting that emergency room for things that are non-medical. So, or they might think are medical, but the underlying thing that's happening is a non-medical support needs to be addressed. Older adults who are having that hard time accessing services in the community and would benefit from someone to come and chat with them about those resources and then help with that connection piece. It could be an older adult who's feeling isolated and disconnected and wants to work towards feeling connected um, and those pieces. Whoops. And then an older adult caregiver, it could be who needs that system navigation support. So they're taking care of their partner, but also need support for themselves and would benefit from having somebody involved to kind of help navigate the complexity. All right, so how do you get connected with our team? So you or someone you know who's engaging with their healthcare system you can ask your healthcare provider for a referral. They should know about it, but if they don't, I can give you, Sarah, the pamphlets and you can share them.
Yes.
And then we have an online referral kind of process and intake form that the healthcare professional would fill out. And then once we receive that, our central intake would start connecting with that older adult and then connect them to the agency that's supporting them.
All right, and I just take a minute here just to say that I just put my email in the chat box. So if anybody wants to copy and paste that, and you can reach out to me at any time, and I can put you in touch with Megan and somebody with the network here.
Beautiful. Once the referral is made to our network, you'll be assigned to a team, and then that team will come out and arrange either a home visit. You can come into one of our agency offices or a convenient community location. One of the pieces around social prescribing is that feedback loop. So there is a feedback loop with your healthcare professional or whoever referred you. And they can kind of give an update about what we're doing with your consent, or just continue to say we're involved. Varying levels of information could be shared depending on how much you want. And then our outreach team completes an assessment, and then that kind of identifies those areas of, sorry, excuse me, goals, and your service or care plan is created. Now, I have some stories, but I'm willing to skip over them if we're short on time.
No, I think we're doing pretty good. We're only 30 minutes in, so.
Alrighty. Okay, so I will read the story. So after a 5-month hospital stay due to a fall, our client was discharged and faced challenges with her health at home. To support her recovery and prevent readmission, we connected directly with home care services to establish a plan of care to include assistance with hygiene, medication management, and wound care. With this support in place, the client remains safely at home and has not needed EMS or emergency room visits, which is a strong indicator of the effectiveness of coordinated and in-home care. And additionally, we provided her advocacy around her short-term disability benefits, which helped relieve her financial stress, allowing her to focus fully on healing. And then we have a 62-year-old gentleman who was
Megan,
referred.
sorry,
Yeah,
before you said the second story, I had a question because I heard in that first story, so I don't want to lose it, that it was a home care client. Now, my question was, were they already a home care client before they came to Karya for assistance, or you guys applied for this person to be a home care client on their behalf?
yeah,
Oh, I love that.
yeah.
That's wonderful because I have so many calls all the time because I also manage our adult day program at Kirby. And I hear all the time phone calls about how can, I get my loved one to be a member of this program. And I always say you got to be a home care client first. So are you a home care client? If not, I just point them to the number that I have online, the Alberta Health Services. But I can also point them or their caregivers towards you guys as well.
Yeah,
I love
absolutely.
that. Thank you.
Absolutely. Okay. So we had a 62-year-old gentleman who was referred to In Place due to his declining health, food insecurity, and unstable housing. He had been living in motels for multiple years on a limited AISH income, unable to afford essentials like food, medical supplies, a phone, and winter clothing. So as you can imagine, without the phone, he's unable to access home care, like we talked about,
Mm.
or book medical appointments. And he was using emergency services as his only option for engaging with whatever support he needed. By mobilizing internal and external resources, our team acted quickly to stabilize his situation. And within a week, he had received a food hamper. He got the winter clothing he needed. He got the cell phone to connect with supports. And then he got essential medical equipment so that he could manage his condition at home and connect with those in-home supports um, so that he can still remain independent in the community. Great. Okay, so these, as you heard in the story, these are kind of the 6 buckets of areas that we can help with, but are not limited to these 6 if you're like, but I need help with X. So if you find you're not getting the help you need, you can always ask, could you help me with this? But these are kind of the 6 big things that our team works on. So we can help with accessing safe and affordable housing. So we can help with the application process. We can help navigate YYC housing and how to do that online application. We can help kind of coach on how to use like Rent Faster and things like that to kind of look and see if there's more affordable housing available. We can provide that connection with your healthcare team. So if you don't have a doctor and want to look into getting someone to kind of be following you more frequently around your healthcare connection, or if you're having difficulties communicating with your healthcare team and want some coaching or how can I express my needs so that they understand. We can help navigate the financial benefit system. So whether that's AISH or Alberta income supports or the pension system or Alberta seniors benefits, we can kind of help navigate that system because that can get quite complicated. And then the big piece is this purple blob. So we can help build social connection with the goal of reducing loneliness. So in this blob, we have what we would call a link worker, and that role works specifically around this goal is to build that connection. So they can go with you to a social event. They can go, if you have like social anxiety, they can go with you to a group to kind of help reduce that anxiety and help build that connection within the group so that ultimately you are comfortable going on your own. They can help kind of coach on how to utilize Access Calgary or how to with you for that interview for Access Calgary or go with you for a housing interview, those types of things that maybe have that heightened anxiety. They can go with you to kind of help reduce so that you're successful. Our team can help access those transportation supports, as I talked about before, and then accessing those in-home supports. So whether that's the formal like home care or a friendly visitor or getting you equipment in your home so that you can stay ultimately for as long as possible.
I love that. Megan, sorry to interrupt, but we just had a
Mhm.
question in the chat box there. If your loved one or yourself does not qualify for acceptance into the program, what other options or avenues could they be referred to?
Are they talking about our, like the network, or are you talking about the supports in the community?
Karya, they said.
We're pretty low barrier, so I would be really curious as to why they wouldn't qualify other than age. Like we're very particular about the eligibility that you have to be 55 and older to access this navigation support. Um, but that's, and then you have to live within the city of Calgary. So those would be the only two reasons why we would not take a referral. Um, and when we say that, we would be communicating with that healthcare provider who's made that referral on your behalf, and we would be giving them additional options or directions onto where to access for support.
And then does it have to be a healthcare provider that refers you to this program?
Yes.
Okay. All right.
So on that flip side, we do have a self-referral. Um, that's where the weigh-in fits in. So the weigh-in, you can call 403 seniors and get access for navigation supports. But that program is specifically for 65 plus. So there is an age difference.
Okay. Okay, well, I hope that answered your question, but if not, feel free to type in the chat box again. And thank you so much for addressing that, Megan.
Mhm. I will, so I do have to have the slide in any presentation I do so that people aren't confused. So our team cannot go into someone's home and do these kind of 6 things. So housekeeping, we don't do medication pickups. Our team doesn't do the cleaning, the like actual physical cleaning up around hoarding or clutter, or our team cannot support someone by transporting them in their own vehicle. Um, and similarly, our team doesn't do grocery shopping. Now, the one around ongoing check-ins is somewhat of a gray area because if you are an ongoing client, you would be getting those check-ins or that connection piece with your worker or the team that's assigned to you. However, they're not going to, if your goals are completed and those things are done, they're not going to continue to do that ongoing check-in. But there are resources in the community for these six things that our team would connect you to for help.
Oh, and Megan, there was another question in the chat box there that says, can you share any tips and tricks or best practices for building relationships with formal healthcare systems so they understand how they can refer their clients to Alberta community orgs?
Yeah, for us here, you make it super simple. So make your whatever that referral pathway is super simple. So our referral form is really basic information. It's got a lot of check boxes so that it doesn't take a lot of time for your healthcare provider to engage with the program. What I have found is having some type of program material that you can leave, going in person to a clinic or something like that and introducing yourself. And then for those people that are referring, because once you kind of get it going, um, when you actually start building those relationships, kind of nurture them, check in with those people who are referring to build that relationship between the program. So it's not just uh, this ambiguous program that you're always referring to. And yeah, it works, but you don't really have that relationship um, with them. And then scheduling presentations to multiple times to the same team because there's a lot of movement and change within teams. So always kind of keeping them up to date on the referral pathway and the program information, if that makes sense. I hope those are helpful tips.
Thank you, Megan.
Okay, so I think this is my last slide. So in the last year, we had 763 referrals into our team, a majority coming from that primary care network and hospital discharge and emergency room, if you combine the two. And then we have a lot of community-based organizations and programs who are also referring into, specifically if they have that healthcare professional role within their team. So it's a lot of like counseling, counselors, it could be social workers within kind of those community-based organizations who are assessing that someone needs that additional support, specifically around the ability to go into the community, into wherever that person's living, and do that assessment and meet them in their own home. Because a lot of programs don't allow you to do that. And then on our team, we have our intake coordinator. So all of the referrals come directly to her and then gets dispersed to each agency. And across the 3 agencies, we have 13 outreach workers and then 6 link workers currently who are doing that work in the community.
Wow. We have another question in the chat box. If Caria itself or the network had unlimited funding and resources or supports, where would growth for services grow and aspire to reach?
Oh my goodness. Those are big questions.
Oh, no, I know.
If finances were not an issue. I don't actually know how. I think what we would want to see is more of that capacity building within the community. So whether that's looking around like transportation, how do we kind of build capacity around that for older adults? Because that is a huge gap. How do we build capacity around the opportunities for social connection? Sometimes there's wait lists for groups, there's wait lists for a friendly visitor, there's, like how do we build capacity so that there isn't that long wait to get the support that you need. I think that is where our team is seeing, that's where we're seeing the gaps, and where if you had unlimited, not that money fixes everything, but if we could address some of those gaps too. Yeah, I think that would be kind of the areas that we would want to see.
I agree with that. I think that's a great answer because I think those, like our wait list sometimes, I mean, ADP, it can be a minimum 6-month wait list, and most times longer. I think we're at a year recently. So, yeah, just being able to have, something either, in the meantime or instead of, right,
Mhm.
would just take a load off of some shoulders.
And I think also if you had unlimited funds, which is like the dream world, but having this navigational support for other age groups, like social prescribing could be applied to multiple age groups. Specifically, if you are a parent of someone who has complex health and you're trying to navigate that healthcare system, or you're just under the age cutoff, like you're
Yeah.
45 and need help navigating that system. Like, what does that look like for you? And what are the supports in the community that can actually help you and give you the answers without having to go to um, 5 different people or
Yeah.
find the information out on your own?
That's what I was thinking too. That kind of 50 to 64, they're kind of, just kind of hanging in the balance there. So that's a big gap, I think, in our system as well.
And I have two other stories, but I'm kind of mindful of time and don't want to be just the talking head if people had other questions.
I love that. Very thoughtful, Megan. Thank you so much. And I will take this moment just to say if there's any, we got about, 14 minutes if I'm being accurate, left. So if anybody has any last minute things or stuff that they've really been, itching to say, please type it in the chat box. And Megan, I think this is a great time to share these two stories.
Okay. Um, okay. So, our first story is a client who was referred to our program after the loss of her husband, who had previously managed all of the daily tasks and was able to communicate in English. So she had English was not her first language, so she was having difficulty engaging with the community. Um, she was grieving and overwhelmed, and to add to the complexity, she was also caring for her older adult son. She needed support around daily tasks, government forms, and accessing healthcare services. Our team was able to connect her with with supports in her first language. So that was specifically around culturally appropriate counseling, and getting some mental health supports in place, securing them a family doctor, arranging transportation, and then obtaining mobility equipment so she could remain safe and independent in her home. And then the third story, although the goal of our network and program is to support independent living within the community, we've also seen some outcomes that have resulted in supporting individuals to transition to a different level of care.
Mm.
So, such as like a supported living situation. So, this is a reminder that sometimes aging in place in the right place is more important than putting just aging in place as emphasis on that piece. So we had John, and all of this has been changed. He was 66 years old and he had been in the hospital 52 times in the last year because he was falling in his home. He had no coordinated follow-up, and his home environment was becoming more and more unsafe. A hospital social worker referred him to our program, where the outreach worker was able to build trust and to understand that John was afraid of losing his independence. He wasn't aware of his pension eligibility, so he wasn't getting all the finances he was qualified for. And he was scared that he wasn't able to afford safer housing. So our team helped him apply for the benefits he was eligible for and stabilized his finances. And then we arranged for a day pass when he was in the hospital to tour a supportive living site that would meet his needs. And so helped kind of support that transition into that environment. So our team was able to go with him for that tour, be that kind of social support during that experience, and then kind of be able to talk him through it after. What does it look like? And kind of take it into smaller increments. What does it look like to move? What do we need to do to get in place for selling your home? Those types of things. And then as far as we know now, he is now living safely. He's thriving in the appropriate level of care, and he has had no hospital admissions since he moved in. So I hope that you can take away that these stories show kind of the breadth of work and support that our team can provide, and the complexity and intricacy of each older adult that our team is working with. No story is the same, no support's the same, and so I think it kind of emphasizes the holistic pieces of our work where it is very client-centered and our clients and our older adults are determining where we're going. So I will stop. That was my information that I'm happy to share.
Oh, I love that. And I was going to ask you, Megan, as well, if you could share your information. And we had someone in the chat box type in, is it possible to share the link for your referral form?
I don't usually share it unless someone has emailed me directly.
Okay.
Just because it is the referral is specifically for a healthcare professional, so we don't want it to be it's not a public link, if that
Okay,
makes
okay. Would you mind showing your contact information again,
uh,
so that people can kind of take a picture or you can put it in the chat box if you'd like. Oh, there it is.
yeah, so it's
Yes.
perfect. Yeah, please reach
Excellent.
out if you're wanting to refer or hear more about how we are supporting.
Excellent. Well, I love that. I think that was such a wonderful presentation, Megan. I think I learned so much in this short. We've only been in about 52 minutes if I'm being accurate, gang. You know, we know I've been accurate this time, but man, this was really, really great. So thank you so much for joining me, Megan, and sharing this hour-long, the very valuable information with all
My
of us. And
pleasure.
yeah, I really I can't wait. We're going to get this. It's been recorded, so it's going to be placed on our YouTube page, Unison for Generation 50 plus. If you don't like that YouTube page or you're not subscribed, go in there and click that button. And next week we're going to be back with Vanessa, who's going to talk about how older adults and caregivers can plan ahead and make informed care choices. So come on back next week. Megan, thank you again. This is
Oh,
what I do. I give out hearts after all the presentations. So, oh, I
are
see.
we
I'm
able
gonna
to share?
I'm gonna stop recording for a second.
Oh, maybe then you